Hello, my name is Shirley. In this presentation, I will be talking about epilepsy and seizure. What is epilepsy? It is a chronic brain disorder causing different types of seizures. In our brain, we have nerve cells that act like electricity, which sends signals to our brain for our body to function, such as muscle movements and talking. When there is an interruption in the brain, it causes the brain to send the wrong electrical signals, or when there are excessive electrical activities, it causes a seizure. Epilepsy is a long-term medical condition and usually requires treatments like medication to help prevent it from happening in the future. There are several medical conditions that can cause you to have a single seizures. I will go more into what those conditions are later. These type of seizures usually go away on their own once the conditions are resolved. And having one seizure episode is not considered a diagnosis for epilepsy, as there needs to be at least two confirmed seizures. There are two major classifications for seizures. The first is focal seizures, which happens in a small area of the brain, for example, like the frontal lobe, which is the area in the front of your forehead. The second is generalized seizures. It happens on both sides or throughout the brain when the electrical activities of the neuron is not sending the signals properly. The presentation of a seizure may present differently based on the area in the brain where the seizure starts and will vary from person to person. For symptoms of focal seizures, the person is fully conscious and awake, may experience seeing or feeling things that are not real, just like having a dream, have movements to one part of the body, like in one hand, leg, or repetitive eye blinks or twitches. Some may experience aureas, which is an unusual sensation of feeling the seizure coming on or seeing a flashing light, and this feeling can happen for hours or days before experiencing an actual seizure episode. After a seizure, some may experience a headache or pain in the muscles that were contracted during the seizure episode. These seizures usually last for no more than 2 minutes. And then going on to generalized seizures, the person may lose consciousness and may fall if they were in a standing position, have muscle contractions, and depending on the type of generalized seizures, the person may experience symptoms differently with one or a combination of these, staring into space with or without twitching of the muscles, have stiffening of muscles of the body, such as the back, legs, and arms, have repetitive, jerky movements of the muscles on both sides of the body, like the arm and legs, have loss of muscle tone that causes the muscles in the body to weaken, causing the person to fall. The cause of seizures can be anything that disrupt the normal electrical activity of the brain cells. There are possible causes, however, about half of those living with epilepsy do not know the cause. Some of the risk factors and causes can be linked to genetic factors, developmental brain abnormalities, stroke, brain tumors, infections, brain injuries, hypo or hyperglycemia, alcohol withdrawal, and then eclampsia, which is a life-threatening condition that can happen during pregnancy, and febrile seizure. Febrile seizure is a condition seen in children and may occur when there's a sudden spike in body temperature with no other underlying seizure-provoking causes. There are two types of febrile seizure. It's simple and complex. Febrile seizure often happens within 24 hours from the onset of a fever, and it is usually the first sign that a child is ill. Symptoms include body shakes, stiffness or twitch in one area of the body, fever greater than 100.4, loss of consciousness. In simple febrile seizure, it is most common. It's not specific to one part of the body and usually lasts from a few seconds to 15 minutes and will not recur within a 24-hour period. In complex febrile seizures, it is confined to one side of the body, lasts longer than 15 minutes, and will occur more than once within 24 hours. The causes include an elevated body temperature, infection, usually caused by viral rather than bacterial infection, and then post vaccination. A child may develop a low-grade temp after receiving a vaccine, like the DTaP and the MMR. Please note the vaccine itself do not cause the febrile seizures. It's the elevated body temperature is what causes the seizure. Risk factors include young age from between 6 months to 5 years and a family history. For complication, it usually have no long-lasting effects and does not cause any brain damage, intellectual or learning disabilities. Having a febrile seizure does not indicate an epilepsy disorder, as epilepsy is a recurrent unprovoked seizures caused by an abnormal electrical signals in the brain. So for management, over-the-counter medications like infants or children Tylenol or ibuprofen may be given to manage fevers. For prescription, anticonvulsant, it's rarely used but may be used to prevent febrile seizures. However, the side effect may outweigh the possible benefits. Rectal diazepam and nasal medelazam may be used in children who suffer from febrile seizure lasting longer than 5 minutes, or if having more than one seizure within a 24-hour window. It is only used to decrease the time sensation and not for preventing the febrile seizures. What to do when someone is having a seizure? There are many types of seizures and they may present differently. However, most seizure episodes usually last for a few minutes. When you see someone having a seizure, make sure to stay with the individual until the episode ends or they are fully awake and alert. Remain calm and do not be afraid. If you witness the start of a seizure, help ease the person to the floor safely and gently turn the person onto one side, as this will help with breathing. Ensure the area is clear of anything that can harm the person. Once the individual is alert and is able to communicate, tell them what happened. If the seizure lasts longer than 5 minutes, or if it's the person's first seizure, call 911 right away, or if the patient is already in an acute care facility, follow facility's protocol. What not to do when someone is having a seizure. Do not hold the person down or stop their body movements. Do not put anything in the person's mouth, as it can injure their teeth and jaw, or they can choke on it. Do not perform CPR by pressing on their chest or give them air by doing mouth to mouth. The person will eventually start breathing on their own once the seizure episode is over. Do not give the person any water or food until he or she is fully awake and is alert, because they may not be able to swallow properly and it can go into the lungs, causing pneumonia or infections in their lungs. To diagnose and detect the causes of seizures, we would perform a review of symptoms, take a complete medical history, and do several diagnostic tests, which would include neural exams and blood tests. These are several imaging tests that may be performed to detect for any brain changes. EEG is the most commonly used, where small electrodes are placed on the scalp with adhesive, and it would record the electrical activity of the brain. To find an effective treatment, it is important to identify the types of seizure and where it begins. To find the right medication and dosage, we need to consider their condition, how often it's occurring, their age, and other factors like what other medication they're taking and if any contraindication. Sometimes medication alone may not prevent seizure from happening and may need to be used in conjunction with other treatment approaches. Surgery may be an option if the anti-seizure medications are not providing adequate control and if they're a good candidate. Other available therapies are um, vagus nerve stimulation. It may be used in addition to the anti-seizure medication if seizures are not well controlled and the patient is not a surgical candidate. The device is used to stimulate the brain to reduce seizures by 20 to 40%. It is implanted underneath the skin of the chest, similar to a heart pacemaker. For deep brain stimulation, it is another device used to decrease seizure episodes. The electrodes are implanted in the chest and it sends electrical pulses at a time interval. And responsive neural stimulation is an implantable pacemaker like device that helps to reduce the frequency of an episode. It analyzes the brain activity patterns to detect seizure as it occurs. And the next, ketogenic diet. It may help to reduce seizures. However, it should only be done under close supervision of a healthcare professional. Experts don't fully know how the diet works to reduce seizures, but researchers thinks that the diet creates chemical changes and alters the action of brain cells to reduce and suppresses seizures. And then clinical trials may be another options. Referral to a specialist or an epilepsy center may be recommended if seizure persists after more than a year of treatment. Earlier referral can be considered if indicated. And lastly, alternative therapies. It can be used together with conventional medicine or alone. So we have natural herb supplements like cannabis, mind body practice like yoga, and the discontinuation of an anti seizure medication may be considered if the patient have been seizure free for more than 2 years with a normal EEG and MRI. The medication can be slowly tapered over several months under the supervision of a neurologist. Epilepsy cannot be cured. Despite taking medication to manage epilepsy, there's always a risk of having another seizures. Managing patients' seizures include interdisciplinary team. The right treatment involves patient is able to self-manage seizure condition by tracking their seizures, manage their triggers, take medication as prescribed, check with provider before taking other medications or supplements, able to communicate with healthcare team, getting about 7 to 8 hours of sleep, follow a well-balanced diet and maintain a healthy weight, avoid tobacco, excessive alcohol, or abuse other substances, provide resources for support groups to promote self-management and improve quality of life. Um, and then we need to monitor lab work. So for patients on enzyme-inducing drugs, CBC, electrolytes, liver panel, and other and bone metabolism studies can be monitored every 2 to 5 years. Routine drugs levels and monitoring is not recommended and should only be performed if clinically indicated. Thank you for listening to my presentation on epilepsy and seizure.